welcome back to All Angles. Dis-Chem and other pharmacies from this week are administering the Pfizer vaccine on their premises, but the public still needs to use the government registration process in order to book your spot. At the moment, only people aged over 60 and above can get the jab. Heidi Jokos in NORWOOD pharmacy for us up here in Johannesburg. Hello to you, Heidi. Yesterday outside Mill Park Hospital, one of the public venues where people will be able to get the jab eventually. Now, though, as you were talking about to me yesterday, the private sector stepping up, and it's exactly where you are today.
Yes, certainly. I think it's crucial for a government to rope in the private sector to assist with the mass vaccine rollout. But of course, this will include smaller pharmacies and smaller role players to assist with the vaccine rollouts, especially for phase 2, where we are seeing senior citizens and elderly getting vaccinated. But we are in NORWOOD pharmacy, where we are joined by the owner, Joseph KRUGER. Thanks so much for your time, sir. You were telling me that you guys are ready. This pharmacy can administer the COVID-19 vaccine. Speak to us about how that's going to unfold and some of the challenges you are facing as a smaller player in the bigger scheme of the vaccine rollout.
Okay, we'll hold it. Yeah. we are ready for vaccine rollout. We have our permits, we have our nursing system, we have 2 vaccinators. We're ready for it. Problem is the frustrations that have come with it. Our councillor, city councillor, put out a note that NORWOOD pharmacy is ready to roll out, but the huge frustrations. We haven't heard from Department of Health. We don't know which vaccines we're getting. We assume it's Pfizer. We don't know the payment. Payment is a huge problem. We're a small independent pharmacy, and up to Thursday, the Department of Health was going to cover everybody as free vaccines. Subsequently, we got a letter on Thursday saying that we will be responsible for the vaccines coming from Biotech, which is the supplier, on a 90-day account, and we have to charge people. I mean, that was totally against what the government arranged. They said free vaccines for all. We're living in a very multinational suburb of NORWOOD, where we have very few people, or a fair 50% are not on medical aid. They want to know how are we going to pay, or who's going to pay us. Medical aid we're happy to do, because apparently medical aids have agreed now to pay. The frustrations are huge. We don't know the dates. According to our councillor, we should already be giving them out. We're ready for rollout. We're totally ready for it. But we haven't a date for this phase of when we're going to get stock, who's going to pay for the stock, and how we're going to administer of paperwork. We haven't got a program installed yet of how we're going to give transport or cards that they've had the vaccine, and how we're going to SMS them to say they've had the vaccines. Also a huge problem is that we haven't got the programs available there. So programs and stock and cost, huge problems.
Yeah, I mean, those are huge challenges. Just speak to us about how many people you can vaccinate per day in this facility. I mean, it is quite a small pharmacy, but as you mentioned,
we've done a fairly good look at it, and we've decided that we could turn out 6 people every 15 minutes. 2 vaccinators, 15 minutes for the people to see that they have no reaction, just to give them a little bit of a lecture of what the vaccine's all about and what they can expect as side effects, and then out. So every 15 minutes we can turn around 6 people from 8:30 till 4:30 every day, 6 days a week.
You are expected to start on the 2nd of June. That's next week. So what happens now, given the fact that you still have so many unanswered questions from the department when it comes to costs and all the other issues that you have mentioned? Are you going to start next week Tuesday, or are you going to wait from government to give you the go-ahead on who's going to take on that cost?
From government. We're ready to go next week if the stock arrives, but cost is a huge factor. I, as an independent pharmacy, cannot afford 50,000 Rand a week to pay on my own if there's no support coming from the government or medical aids. We have no clarity. I read in the newspaper on Sunday Times that medical aids would cover Pfizer to 385 per dose, Johnson & Johnson 330 per dose. We have no official clarification on that, and no official clarification from Department of Health of who's going to pay for people that are not on medical aid. So we're ready to roll, but cannot do anything until we have clarity of what the costs involved. and who's going to pay for the vaccines.
Okay, great. Thanks so much for your time. We do appreciate it. I do think that, Gareth, there's definitely a lot of uncertainty with regards to the smaller pharmacies needing to roll out the COVID-19 vaccine. Cost is a major issue, and this is something that Dis-Chem had also told us earlier this morning, that they will actually be turning people away if they're not on medical aid and if they are not 80 years old or plus, because they cannot take on that cost without any clarification from the Department of Health on who is going to pay and how they are going to pay for the vaccine. We've been told that nobody should be paying for the vaccine, so government most certainly needs to clarify that aspect.
Access to medication is something incredibly important. Access to the vaccine cannot be put in place and withheld because there are too many people in this country, Heidi, who don't have the money or the means to be able to get the very basics like a COVID-19 vaccine. I'm sure we're going to try and get some clarity from government now that we've heard from the smaller pharmacies who are simply trying to help and get the vaccinations out. My thanks to you, Heidi Jokas, for us in Norwood at a smaller pharmacy up here in Johannesburg. So the big players seem to have all their ducks in a row as far as payment is concerned. The problem seems to be the smaller private pharmacies. How are they going to do it? And as they quite rightly say, who's going to